Welcome everybody to our presentation tonight. I am Doreen Hindman. I am the Executive Family Connections Administrator for the Sashbear Foundation. Just to let you know briefly, the Sashbear Foundation is a charitable organization. We're based in Toronto, but have a presence across the country. One of our main activities is delivering the Family Connections program for family members. But we have also, since the pandemic began, started doing these educational presentations with a series of experts on related topics related to borderline personality disorder and emotional dysregulation, specifically from the perspective of the family's perspective. So I would just like to let you know a couple of things. First of all, this is a webinar, and that means that although we are recording it, we are going to be, your names and faces and all of that will be hidden. So none of that will be recorded. You are all anonymous as attendees. If you have to leave early, you will be able to see the recording at another time. It will be posted on our website. Also, just to let you know that we will have time for questions at the end. We're going to disable the chat, but you can click on the Q&A button and that will allow you to pose a question. So Kathleen and I will be moderating the questions. So then let me just do some introductions. I am joined by Kathleen, who is a volunteer with the Sashbear Foundation, and also by Lynn Corey, who is the co-founder and president of the Sashbear Foundation. And our presenter this evening, who I am very pleased to welcome, is Adina Hauser. She has a Master of Social Work, is a registered social worker, and currently is working as the clinical lead for the new Transitional Youth Program at Michael Garron Hospital, which is in Toronto. Adina has over a decade of experience working as an individual, group, and family therapist with youth and young adults aged 14 to 25 with concurrent mental health and substance use concerns. She completed a BA at the University of King's College, her MSW at the University of Toronto, and a postgraduate fellowship at the Sick Center for Community Mental Health, where she specialized in family therapy. Her areas of expertise include trauma-focused therapies, family therapies, motivational interviewing, parent coaching, emotion dysregulation, and complex substance use disorders. And I also know that she's very familiar with the Family Connections program that we offer and is a strong proponent of that program. So we are so pleased to welcome Adina with us tonight, who is going to talk about that relationship, that complicated relationship between mental health and substance use within youth, and specifically from the family perspective. So thank you so very much, Adina, for joining us tonight.
Thank you for having me. Okay, so it's my pleasure to be here tonight to talk with you all about just that, the complicated relationship between mental health and substance use. And I hope that I can have you walk away with some tips or some food for thought in terms of how to best support your loved ones and yourselves. This is a really difficult time in general, and especially what we're going through now with the pandemic. And so I really want to give you information and knowledge to move forward with. And I hope that we are able to achieve that tonight. And thank you for coming on this journey with me, which is, I'm sure, very confusing and leaves you with lots of questions all of the time. So my agenda for tonight is really to understand what happens with adolescents as they grow, to look at the relationship between mental health and substance use in youth, and to look at some common family issues that families go through, and then strategies and resources for you. So I want to start by looking at developmental changes in adolescence, because this is a really important place to start to set the stage for what happens to teens and young adults as they grow. We know that the brain really develops into our mid to late 20s. And so there's a lot of action happening in this stage, which sometimes explains why youth struggle with their mental health and their substance use. Really, the goal for young people is to become independent in few short years. It's actually a ton of work the brain does in a very short period of time. If you think about the span of our lifetime, practically, emotionally speaking. And youth really need to try out ways of living and being in the world that sometimes don't sit well with us as family members, because it involves a lot of risk and a lot of uncertainty and the unknown. There's a lot that's developmentally normal about what happens in adolescence. There's a lot that's abnormal, and there's a lot that's worrisome, even if it's risky, and there's a lot that is normal, even if it's worrisome. We know that youth have a dominant limbic system, which means their emotion part of their brain is on fire when they are teenagers and young adults. And the part of their brain that's the rational part of their brain, the part that's supposed to do all that long-term rational thinking and impulse control and those types of things, is very underdeveloped. That's the last part of our brain to develop. And so even if you think about that combination, sometimes it's the recipe for why youth seem to do really stupid and risky and fearful things when they're young. Peer influence is prioritized in the brain. That's how youth get ready to leave behind their parents and their families in search of independence, and our brain primes us for that. And it prioritizes immediate rewards over long-term consequences. One, it's got to try out what works. And two, the part of our brain that takes into account the long-term has not developed yet. There's a sensitivity, more priority towards novelty seeking, stimulation, impulsivity, risk-taking. Again, it's all practice. Youth question everything. This is how the brain builds its capacity to think in complicated ways. These are all things that need to happen so a young person can become independent, but it's not without risks. And it sometimes, like I said, explains why we see a lot of onset of difficulty in a young person, or frankly, a lot of risk. And I say that over and over again because we're going to be talking about risk tonight. It's a part of the package. Adolescents are becoming adults and learning how to manage their emotions and to take on the world independently of people who are supposed to cope for them. But the adolescent brain copes differently than an adult brain because it's still developing. Like we said, there's lots of emotion and lots of impulsivity. There's not a lot of rational brain thinking happening yet. And so it becomes really hard for a young person sometimes to cope. They frankly don't cope like we do. And even thinking about it from our perspective as an adult, how we might cope with a situation is different because our brain just frankly looks different. The risks that we need to take as a young adult and as an adolescent have to prepare us without the aid of an adult in our lives to clean things up or to help us manage. But we're not necessarily good at doing that on our own. And sometimes we rely on things like coping aids to help us with our emotion management. Some of those things might be drugs or cutting or video games, avoidance, other impulse behaviors. Some of this is normalized. Youth are already set up for this. They are on social media. They play video games. They're primed because of natural experimentation with drug use. Adults are set up for this as well. If it's any indication of how much I scrolled through Twitter and ate chips last night because of the stress of the election, we're all set up in a sense to use something else to help us cope for us. And some of that is okay if we do it a little bit and once in a while. But if it becomes a pattern and we start to rely on these things to help us when we experience emotions, especially when we don't have that prefrontal cortex, that part of our brain that's supposed to rationally think and problem solve, we can develop problems in the longer term. Over time, if we really rely on using other things to help us cope, it can lead to problems down the road. Mainly, our brain learns that we can't do this alone. We can't manage our emotions on our own without the support of something else, whether that is a substance to help us through, or Twitter, or chips, or another person, or avoidance. We learn that we cannot do it on our own, and we develop ongoing difficulties in managing our emotions. Some of these problems, some of these patterns lead to problems in thinking, self-esteem, problems in relationships, anxiety out anxiety. Has anyone here ever started to feel anxious before they feel anxious? You feel nervous about being nervous. Sometimes that happens to me. We anticipate that we're going to have an emotion that we don't like, and we either avoid it. So we avoid the act that might make us nervous, or we already start to cope with something else to help us manage in that moment. So avoidance becomes a big part of the package. We might start to really judge ourselves and get down on ourselves for things. We might develop other problems. And frankly, it might be really hard to start meeting our obligations like work and school if we don't know how to do basic things like manage our emotions. Our brain starts to learn that these coping aids are what we need to get through. And we unlearn the idea that we can cope for ourselves. And when we no longer have that certainty of knowing how to cope by ourselves, we need something else to do it for us. And it becomes the thing we rely on. And I really, really want to emphasize this, because this is really going to help us understand why people in general, and especially youth, may use substances to cope with their emotions and their mental health. So sometimes we end up in these cycles of what we call in the clinical world maladaptive coping, this idea that as soon as we start to experience emotion or have emotional arousal, we already know that we're not going to be able to handle it very well, or it's going to be really painful, or we're going to need something to help us through. And if we use an aid or something to help us over and over and over again, and our brain has the experience of the reduction in that pain or that painful feeling, our brain puts two and two together and says, I need that thing to help me cope, or I cannot experience that negative emotion anymore. And even before we are going to experience it, even the thought of it triggers that desire to use that aid or to avoid or whatever it is, to not have that painful feeling. I was talking with a client today, and she described so beautifully her relationship with cutting. She said, it's my strategy for getting out of feelings I don't want. And this is someone who's trying to stop cutting. She can name you all sorts of reasons why cutting is dangerous for her. It's not helpful. It doesn't actually make a difference in the long run. And she still also has this belief that it is the thing that helps those feelings, those unwanted feelings, go away. It has a function. It has a use. And unless she is able to find other things that might help her, or that internal strength within her to tolerate that difficult emotion and the emotions that she doesn't like, she will have to rely on cutting, much like someone may have to rely on substance use. Drugs do interesting things in the brain. Ultimately, they can help, and they help in lots of ways. They help with avoidance, they help with lowering pain, with producing pleasure. Apart from the downsides, and I'm sure we can name many downsides of substance use, obviously, they also do the job they're designed to do. Drugs in the brain attach to our dopamine receptors. Those are our pleasure chemicals, and they release them. So when the drugs attach to those receptors in the brain, they produce that rewarding effect, that feel good. And the more that we experience that, the more that our brain takes in the drug and attaches to that dopamine receptor and releases that feel good chemical, the more our brain is going to prioritize that feeling over other feelings or other experiences, because our brains love repetition. They want to do what works over and over and over again. And there are things that will cue that in our brain even before we use. The crazy part is that our brain will start to release that dopamine just from thinking about it after a while. Even before we've used, it starts to release that dopamine. And it really solidifies the association between using a substance and that feeling, that release, that relief that your brain might experience. And so you can see how some people get trapped in how drugs can help them, because there's this real association that gets made in the brain, and that can make it really hard to make any changes. Now, not everybody experiences massive consequences with drug use, and not all drug use leads to those massive consequences. The truth is that most young people will use substances without major consequence. They will experiment, they will use with friends, they'll drink at parties, but they don't experience a lot of consequences of substance use. And the fewest amount of young people will experience the biggest consequences, the most dire of consequences. And that's really where we're talking about addiction and physical dependency. As you start to use more and use in ways that are detached from experimentation, that's when you start to see the consequences of substance use, when you've failed to meet their obligations, when they start to experience, whether it's physical or psychological or relationship problems as a result of their use. And when they keep using despite those consequences, that's really what we call substance abuse, when the consequences are clear and we continue to use anyway. Addiction really comes in at that point, and physical dependency is really what we talk about when someone experiences physical withdrawal in their bodies when they stop using. But this is really important to talk about because substance use can have a function in someone's life, but there can be fewer consequences. Substance use can be experimental and have huge consequences. It really depends on the person. It depends how they use, why they use, who they use with, and why they continue to use over time. What is that function of the substance use? What does it help with? Is really the question that I like to start in. And why do some youth develop problems and others don't? Well, there are certain risk factors that make substance use more problematic for some youth than others. One, developmentally normative behaviors like risk-taking, impulsivity, which again are normal for young people in their brain development, are also risk factors for developing issues with substance use. Sometimes early brain development or genetic factors can influence whether someone is at risk of having substance use issues or abuse. Early experiences of trauma or loss, when there's mental health difficulties in the family or substance use difficulties, environmental factors or learning challenges, when someone doesn't fit with their environment, those can all be risk factors for using substance use to cope. Sometimes the difference between how old someone is, their chronological age, and how old they are developmentally, how much are they meeting the developmental stage they're in, sometimes that gap, if there's a big gap, if someone is 16 years old, really acts like a 13-year-old, or someone is 20, but sort of acts like they're 12, sometimes that gap accounts for a lot of risky activity or negative decision making, and that can really put someone at risk. We know, generally speaking, adolescence, because of all the changes that are happening in the brain, is an age of onset for a lot of mental health issues and substance use issues. As we've said, youth will use drugs as self-medication to cope, and that puts them at risk for further substance use. And the less of an ability we have to manage our emotions on our own, as we talked about, the higher the chance that we'll use something like substances to cope for us and develop more and more risk factors. So why do youth use substances? Well, apart from it being relatively developmentally normative, so normal for youth to experiment with their friends, they also use because it helps, especially youth who struggle with their mental health. And this is really where the complicated relationship comes in. It helps them feel better. They avoid their feelings. It quiets their thoughts. It increases their confidence. There are so many reasons why youth might use. And the truth is, most youth are painfully aware of the consequences of their youth. They hear it all the time from the adults in their lives. They hear it from us. They hear it from their teachers. They hear it, in lots of different ways. And they really are focused, even if they don't tell you, they're focused on the consequences. But rarely do they have the chance to talk about why substances help them. And this is so important for young people to feel heard and seen and understood, which, by the way, as we'll talk about, is the vehicle for them being able to make changes in their lives. And it is crucial that we understand just as much about why they use what's positive about it for them in their lives just as much as what's negative. Remember my clients and her thoughts about cutting. She could tell you all the consequences, but what she really needed to say is why it works, what she does with it, what's it for. And you could talk about cutting or you could talk about substances. I've worked with many youth who talk about substance use in the same regard. It helps, it quiets their thoughts, it makes them feel better. It's the only thing they know that works. So when we talk about the relationship between substance use and mental health, there are many ways that they come together. One, they can trigger each other. So substance use can trigger a mental health issue, for instance, psychosis. One can create the other. So substance use can create psychological distress, let's say anxiety. It can exacerbate each other, like alcohol and depression, right? You feel really depressed when alcohol is a depressant and you can feel really low after you drink. They can mimic each other. So withdrawal can look like a lot of different mental health issues, and they can hide each other. So think about someone who's socially anxious who drinks at a party and then isn't so socially anxious anymore. And we know that there are consequences. We know that early onset of substance use, so the younger you use, the more at risk you are of developing problems later on in your adulthood. We know that it impacts the brain in terms of how we process information, how we learn, our memory, mood, pleasure, motivation. We know that early use of cannabis puts you at risk of psychotic illnesses, especially if you have a family history of psychosis. And we know that it can develop into an addiction or a physical dependence. And the truth is, youth know this too. They really do. They may not tell you, but they know. When we look at sort of what youth are doing in Ontario, a really great study, if you want to check it out, is the Ontario Student Drug Use and Health Survey put out by CAMH every year. They survey thousands of youth across Ontario to find out how they feel about substance use, what they're using, and also their mental health. It's very well regarded. Youth fill it out, it's anonymous. We know that 1 in 5 youth used cannabis in the last year, and to be honest with you, that actually hasn't changed in many years. Vaping is certainly up, and youth are considering vaping not so risky, and I think the experts would disagree with that. And vaping use has really doubled. But what I really want to point out for you is not only the report of what they're using, but also that youth really feel that they don't have anyone to talk to. And that really came through in the last iteration of the study. 40% of students don't talk to their families about what they're feeling. 30% say their mental health really affects school. They're visiting mental health professionals, but they don't necessarily know who to talk to about their mental health. And that can perpetuate problems. Us in the mental health and substance use world like to use this model called stages of change to understand how people change and what decisions they make around changing. And basically the premise is that we go from a state of not wanting to change, so I'll live with whatever I'm going through, even if there are consequences. And that as we slowly make a change, we slowly start to think about the change we want to make, the pros and cons. We get ready for change. We do the change, or we practice changing, and then we try and maintain it. But the reality is it doesn't go in a straight linear process, that we often shift between stages of change. Think about any change you've made in your life, whether it's a gym membership or changing a job or leaving a partner, and think about how you've gone through the stages of change. Well, it's no different for a young person, especially when it comes to their substance use or when it comes to treating their mental health. I want you to think for a minute about your own loved one and what stage of change you think they're in this moment. And I want you to think also for a minute about what stage of change you're in wanting them to change. I bet they're different. So when I ask that question, it's always different. As family members, we're always way more ready for someone to change than they are, or way more desperate, or we have all of the steps figured out, but our young person hasn't met us there yet. And this is really important. I want you to think about it and keep it in the back of your mind, because we're going to come back to it when we talk about strategies. Remembering about what stage of change they're in, it helps us define what's going to be helpful in terms of strategies and working in helping them, and what might be harmful given where they're at. So some of the common issues that I hear about all the time from families when I work with them, and there are lots, and this clearly is not an exhaustive list, but families feel they don't have enough information about what concurrent mental health and substance use looks like. What we're talking about tonight, about what the relationship is between the two. They are struggling to understand the system in which they're supposed to get help. The system is convoluted and confusing and fractured, and how in the world do you get help for someone, especially when you need it? Have our own relationship breakdown with our loved one. There are so many problems that make it hard to be able to help them, whether it's through communication or just the relationship. We don't have influence over their choices anymore. And some of that, again, is normal for a young person to stop wanting their parents' influence. But sometimes it's really hard, especially when you see them doing risky things. There are painful feelings like grief or shame, helplessness, hopelessness, fear. And again, that list isn't exhaustive. Our own parental mental health or caregiver mental health and well-being is compromised when you're trying to help a loved one who's struggling. You can struggle too. Sometimes there are other family stressors. You have other people in your family, other things going on in your life that are also contributing to your stress. Sometimes it's really hard to accept what's happening, and sometimes it's really hard to let go of the fact that a young person needs to start to grow on their own. And the biggest thing is that the more distress we have, the less self-efficacy we feel we have, the less we feel like we can do something about the problems we're having. And really, the focus is on lowering that distress so that you have the strength to be able to tackle some of these things and help your loved one. I learned a couple of years ago about this metaphor, and it was so powerful. It wowed me about understanding the connection between you and the relationship with your loved one when they're struggling. And Adele LaFrance, who is one of the originators of emotion-focused family therapy, shared this metaphor. And she said, your loved one is like a fortress, and they're sealed up for good reason, whether they're just trying to become an adult or they have distress or shame or whatever you want to call it. And your job as a loved one is to get in the fortress. But you have to lower the drawbridge to be able to get in. And you can't. You're a foreign entity. You don't belong in the castle. So you can't just lower the drawbridge and ask to come in. They need assurances that you're not going to attack, right? You're a different country. You're invading. They don't want you to. They want to make sure they can trust you. And the only ways we really get in the fortress are through validation and empathy and acceptance and patience and all of those things that are really hard to achieve the more desperate you are for change. Remember, that stage of change you're in is way different than their stage of change. But you also have another enemy on the side that's making it hard to stand there and lower the drawbridge, and it's your own emotions and your own distress. And all of a sudden you're dealing with your own struggles and trying to get that drawbridge down, and no wonder it feels impossible at times. And if we can't manage that attack from the side of our own emotions and distress, how are we going to be able to get in the fortress? We're just simply not ready. And I want you to keep that metaphor in mind as we go. Before we can enter the fortress, before we can help, we need to ask ourselves these important questions. And these questions are crucial to being able to know what to do to help your loved one who's struggling with their mental health or their substance use. The first question is what I'm seeing developmentally appropriate, whether I like it or not? Those two things they don't have to go together. I don't have to like something for it to be okay. Is it developmentally appropriate? Is it experimental, or is it addictive behavior? And can I adjust from seeing something as risky to seeing something as risky and necessary for learning? And the other question, do my fears fit the facts? The fears that I have about what's happening to me or what's happening to my loved one, do they actually match up with the reality that's happening in front of me? As much as we want to say that it always does, it doesn't. Sometimes we're very scared of an outcome that is unlikely to happen. And we need to understand why we have all that fear. And if our fears fit the facts, then great, then we strategize. But if our fears don't fit the facts, then I need to manage my fears in a different way. So I don't interfere with their development, with their growing up and their change, even if I don't like it, even if it's risky. They still need to be the drivers of the change. validation is an enormous part of this puzzle. And what is validation really in a nutshell? It is the identification and communication of your understanding of what the other person is saying or feeling, regardless of whether you agree or regardless of whether you believe it to be true. Why are we talking about validation? Validation is this idea that I get you and what you're going through, and it is the key to unlocking that fortress. You don't get in without it. Unless someone feels that you hear them and understand what they're going through, their experience, not your interpretation of it, but their experience, they're not going to let you in to help. And this is really the place to start, because without it, we don't get to the point where we can help someone. Validation helps calm us down. If you've ever had the experience of someone saying, oh gosh, that must be so hard for you, everything just calms down. You feel a weight off your shoulders. Someone gets it. You feel understood. You feel less alone. It builds your connection and trust. And it has brain benefits. It actually releases oxytocin. It lowers your cortisol, which is your stress hormone. Validation is very good for the brain and for the soul. Why is it important? It's important because our feelings are automatic. We don't choose them. Even if me as the spectator, as the outsider, think it feels totally unreasonable why you're freaking out about what you're freaking out about, or why you're struggling. Because we often feel helpless about how to manage our feelings, even if the answer's right in front of us and makes sense. And validation helps because we have legitimacy in wanting things, even if others disagree, because we can work so hard at something and fail to achieve it. And we need to validate that in other people, because effectiveness isn't 100%, because youths are supposed to see it differently than you do. That's part of their development. Upset is normal. Just because we have negative emotions doesn't mean that we shouldn't have them, just because they feel bad. Sometimes we need to know someone's willing to listen without trying to fix, and that they accept us. And that sometimes what I'm going through is the only option I have right now, if I don't feel like I have another tool to manage. So you're asking yourself, well, then how do I help? Because I can validate, I can listen, but how do I actually help? Well, practical support only comes when the drawbridge is lowered. And we do that through validation. If they feel heard, they'll be more receptive to your advice and your influence and your support. And I see it and I hear it every day, that that's really your way in as a loved one, as a caregiver. This takes a long time. It doesn't mean that just because I have fears and risks that it's not worth it. And problem solving only works when we have permission, when we can collaborate with the young person in our lives, and when we agree with the problem that we are trying to solve. So in the meantime, what can we do? Because change takes a long time. It doesn't happen overnight, and that can be really scary or difficult. So some of the things that we can do, we can cope. We can accept the reality in front of us. We can have limits. If I can influence your choices, I can set a limit. If I want to influence my choices, I observe a limit. And that distinction is sometimes complicated. I can problem solve only with permission. You might be thinking this feels impossible and there's nothing I can do about it. And there's just this big risky elephant in front of me. I feel really helpless. And I'm sure a lot of you are in that place. I'm not saying you can't change anything. What I'm saying is relinquishing control over someone else's life and the course of their life is integral to them to learn how to survive as an adult. And it's also in conflict with you fixing their problem. When we try and fix, we take back that control. We're saying you don't have the capability to figure this out on your own, that I'm not willing to wait you out, risks and all. And what we really need to be doing is handing that over to our loved ones and saying, you are capable of this, even if it takes a long time. And I will manage myself while I wait and while I help you do that. But it's really for you. We likely have way less control over the process than we think we do. We want control. Maybe it makes us feel better, but we don't have as much control. And the relationship is really where we do have control. If I want to be on the sidelines in the future, if I want to be in a place where I am their cheerleader, where I am able to support them 5 years from now, 10 years from now, 1 year from now, 6 months from now, it doesn't matter. Do I want to be in a place where I'm always trying to wrestle control over the situation? Or do I want to be in that place where they trust me and they want my influence down the road? If we have to be willing to let go and give some of that process back so that they fill that gap, they learn how to do it for themselves. But it means that we have to accept the difficulty that we experience in the meantime, the uncertainty, the risk of that change brings, especially because they are not in the same stage of change that we are. They are likely behind, and they likely will take longer for all of the reasons we've talked about so far. The reason why most evidence-based programs for youth focus on harm reduction is because it understands that youth who gain that control, who learn that they have the capacity to do that for themselves, because they have autonomy in their goals, that they do better in the long run. And it's important to distinguish between harm reduction and this idea of abstinence. Harm reduction means that we recognize that youth have not yet built up the mechanisms they need to survive and to make those changes, and they're capable of managing their lives. So it involves reducing the harms that are associated with continued use. It also includes reducing their use and sometimes being abstinent as well, while reducing the harms. You can be abstinent of one substance and not others, and it assumes that control of use is really essential, and that youth often have reasons why they continue to use. It takes into account all of the reasons we talked about why youth may feel it's their only option in terms of coping. So there's lots of things that we can do while we're waiting for change to happen. And I want to talk about some of the tasks that we have in our last few minutes, some of the things that we can do. When someone is pre-contemplative, which means they're not ready for change, they want to live with what's happening to them, regardless of the consequences, even if there are consequences. Really, there's actually very little we can do in this point. For youth, they need to learn that there's a problem. They need to experience the natural consequences. There's risk involved. And for us as loved ones, it's not really that beneficial to show lots of consequences or to provide lots of education about what's happening to them. It's not always very effective. What is most effective is allowing the natural consequences to occur, having limits for safety and containment, but observing my own limits to make sure I'm okay in the stage. This stage is really hard. It involves a lot of tolerance of risks. And it's really important to seek support from people around you, especially when someone's not ready yet for change. When they start to think about change, they're looking at the pros and cons of making a change, reducing their use, getting help for their anxiety, whatever it may be. They're busy resolving that ambivalence, those mixed feelings about making change. They're weighing the pros and cons. They're getting ready. They would benefit from support at this point. And your tasks are the same. You have to work to resolve your own mixed feelings about it. You're weighing the pros and cons of change. You're helping them work on readiness, and you're seeking support. This stage may feel really challenging because it may feel like a roller coaster. It may not be fast enough. There may be moments where they want to change and are less interested in it, and they may go back and forth. You may feel in the dark, may not always know what's happening. And it can be easy to feel discouraged at this stage as well. When someone's getting ready to make a change, so they've called the service, they have attended an intake, they've maybe handed you their bong to hide from them for a bit, they're getting ready. This is really when they have to learn about what their options are and decide how they want to. For you as a loved one, it's really about having realistic expectations and goals, supporting the choices that they're making that don't have to do with using, and assisting them in any way, shape, or form, and getting the help that they need. And it's really about giving them the autonomy to make that choice about what's best for them. Really about practicing self-care, because again, the speed of recovery is likely not the speed that you want. And you may see them having a lot of difficulties letting go of some of the strategies that have worked for them in spite of the harms. When someone is actually making change, they're busy doing the work. They're learning about their triggers. They are resisting their urges. They're developing new coping mechanisms. they are relapsing. And your goal in this stage is really to do the same, to learn about triggers, to help them resist their urges, to learn new coping mechanisms, to understand that relapses are a part of the learning process, not an indication that you're back at square one. And to plan, this is really important, to plan with them around bumps in the road, because there will be. Change is not linear. We often bump back and forth between being ready for change and not wanting it, and being scared of it and trying it and it being too hard. And we go back and forth all the time. We relapse. We learn, okay, I can't hang out with that friend because that friend clearly can't help me not use, or maybe I did need that service. Maybe I shouldn't have ignored that therapist when they called me. They're learning this all the time, and you have to be with them on that journey and help yourself through it as you feel discouraged with the speed. Once they've made the change, they're busy preventing relapses and learning. And it's your job to help reinforce that, to be prepared in case there are more bumps in the road, to practice your self-care and to communicate, to work on a relationship, validation at all stages of change. And you might see they may struggle again. They may have anxiety around keeping up these changes, and to help them through the process as well. Some things ultimately we have control over, some things we don't. What can we do when we have control? We can exercise that control. We can set limits, curfews, rules. We can manage our emotions. We can choose what we want to do to help them or not help them. When we don't have control, we have to accept that we cannot influence it. We can choose to manage our feelings. We can choose to focus on what's within our control, and we can get help for all of those things. So I want to end here sorry, I had it written down. I want to end here. There's an article that someone showed me once that, again, was one of those powerful aha moments for me. It's this idea, and they spoke about this idea in the article, that our emotions are like tunnels, and we go through our emotions with an entry point and an exit point. And there's sort of no other way around our emotions. We have to feel them and wait for them to go away. We can't rush them. There's no escape hatch in the tunnel of our emotions. And as a loved one, as a caregiver, we can't quicken the process for them either. We have to let our loved ones experience their pain, to learn how to tolerate it, and to wait until they come out the other side. And I want to read to you the end of this article because I think it's really powerful. So rub your child's back, sit with them in silence, stay alongside them as they chug, chug, chug through the tunnel of their feelings, and be with them when they finally reach the calm, peaceful light at the end. I want to end there today. Thank you so much for taking the time to join me tonight.
Wow, that was amazing. Thank you so very much, Adina. I learned so much. And I'm sitting here wishing that I had all of that information a few years ago. And expecting that I'll probably put a lot of it to good use over the next few years as well, even though my own youth no longer live at home with me. But luckily, we do still have a relationship. So hopefully I can put some of this into practice within that relationship. We've got a few questions already, and I'm pretty sure that there will be some more come in. First of all, one of these questions it comes up over and over, so I'm going to throw it at you right at the beginning, is the relationship between mental health and cannabis. And so the couple of questions are, does drug use and cannabis in particular, does it arrest development? Does it prevent the development of prefrontal cortex? Is it really and then the other question that's come up so far is it really a causative relationship? Does cannabis directly cause psychosis, or is it one of those things that you may have the predisposition to psychosis, and that is one of the things that's leading you to the cannabis use?
Right. So the first answer I would give is that, unfortunately, because cannabis has been illegal until recently, there's just not enough research to know definitively what the effects in the brain are. So I think the research community is mixed on whether there are major long-term effects, minor long-term effects, short-term effects. We know that in the short term, it can impact learning, short-term memory, impulse control, those types of things. But I don't think we have the longitudinal research yet to definitively say this has this effect on the brain, and can differ from person to person. We do know that earlier you start using, if you use regularly, the more risks you have in your brain development, because your brain is so sensitive earlier on. Once you get into kind of young adulthood, your brain is a little less sensitive and a little more developed. So the longer you delay use, the better for your brain. We do know that. And definitively speaking, in terms of the relationship with psychosis and cannabis, yes, if you have a predisposition, so if you have a family history, you are at significantly greater risk of developing a psychotic disorder, which can lead to schizophrenia. But even if you don't, you can sometimes develop psychotic symptoms as a result of your use, whether they are long lasting and whether they turn into a chronic psychotic illness probably depends on a number of other factors, including stress. But there are some youth who do develop schizophrenia or other psychotic disorders. I don't know if we can say for sure it's a causal relationship if you don't have any other risk factors, but certainly something to keep in mind. If you have a family history of psychosis, or if you're young, or if you're a boy, those tend to up your risk factors a little bit.
Okay, great. I see a number of requests to put the last slide up again. So maybe if I can just tell people, maybe we could do that. Do you want to do that right now so people can jot a few notes down and we can keep talking?
Yeah, absolutely.
Great, thank you. Yeah, I was scribbling notes like mad throughout the whole thing, and I'm so glad that we have permission to record this, because I'll be watching it again.
I like to do that with webinars too, so I understand.
Yeah, you covered an awful lot of material in there.
I know.
Okay, here's another one, and this is particularly relevant, I think, for the fact that it's a family audience and related to family connections. How do we support ourselves when we're in crisis and we're also struggling to support a loved one? In this particular case, the person says it's been going on for years. My young adult refuses help. But certainly we've all been in that situation as a family member where we are just so completely worn out. We have no more resilience ourselves. What practical things can we do to do that self-care piece?
Yeah. I mean, you get help in any way you can, first of all. And that looks different for every person. You know, with all the family members I've talked to over the years, for some people that they do have, you know, friends or other loved ones in their lives who will be that person, and some don't. So sometimes that help comes in the form of professional help. And having someone to talk to, it doesn't matter who it is, but someone who can validate you and understand what you're going through and helps give you a little bit of respite is number one, the important thing to do. Sometimes when we are, I think, struggling on the hamster wheel for so long, and unfortunately, the reason why sometimes it is so long is because problems span the developmental period. And really, as youth grow, either they figure out some of this stuff or they don't, and it becomes something persistent, or we figure things out as a relationship, as a unit. But I think that at some point, figuring out how to detach from the day-to-day, and that may be only emotionally in your mind. You may still live in the same 2-bedroom apartment with your loved one and not be able to physically detach, but sometimes can we emotionally detach from that role of caregiver, even for a little bit, so we can build back up our energy. You know, we talk about, you can talk about all the cliches of, you know, getting off the roller coaster. It makes sense to me. It doesn't feel like such a cliche. You get off the roller coaster, and in family connections, talk a lot about being able to build back up your emotional energy, whether it's through mindfulness, whether it's through reality acceptance. The truth is, those are journeys. They're not destinations. And we may over and over and over again need to pull back, regroup, re-accept, learn my mindfulness again, go back in, deal with it, pull back, regroup, right? And you want to build up your resources as you go. I do find that sometimes that help comes in, individual help for me. I need to find a different way to manage my distress so that I can get through this, especially when I cannot influence any change in the other person's life. It then becomes about me and how I'm going to survive it while I'm waiting for them to change.
So basically no easy answers.
No easy. As anyone who knows who's ever attended a group with me, I don't ever have any easy answers. Fortunately, it's always my disclaimer at the beginning.
Okay, great. Maybe I'll ask you to close down that resources slide now so that we can see you a little bit better. And just remind everybody that this has been recorded and it will be posted on our website, so they can always go back to see it again. I'm going to ask another question here, which has come up, which is, what is the difference between supporting and enabling?
I wasn't kidding about not having any easy answers.
I was hoping there'd be an answer when you were going through the, like, what are each of the tasks through the different stages of change at the end there, but I didn't see the answer.
Well, I'll tell you, often what I advise people to think about is this going to help them develop the skill to be able to manage on their own? If my support is going to get them through a rough patch and then they're off and running, meaning they can take the learning and develop the skill and engage in it independently, then that's helping. If what I'm doing is setting the stage for me always having to be that person to do for them, then I'm enabling. Because you don't want to have to be that mechanism that they have to rely on that aid. And that's really where we get in this enabling, is if we are interfering with their learning process. And it's complicated because you're not going to see the effect of that right away. You're not going to step back and automatically they learn that skill. So you have to sort of pull back, wait and see what happens. But sometimes that's a helpful way of distinguishing or asking myself, is what I'm doing actually, is it making it easier or is it actually helping? Because if it's just making it easier, it's not helping. If it's really helping just, reduce some barriers and then they go, then that's not enabling.
Okay, great distinction. Thank you so much. I'm going to throw it to Kathleen. Do you have a couple questions there from the chat part?
I have questions. I have questions. The chat's gone crazy. This one here is, what's a healthy way to react when you see that your child is cutting?
Yeah, that's a tough one. And you probably get lots of different advice. I mean, the way that I see it is someone cuts because they're in pain and they're cutting because that's the way that they know how to manage what they're feeling. And so if you focus on validating the emotion and the emotional experience, you can't go wrong. For some people, there is a secondary gain of cutting. So it gets people to pay attention in a way that maybe they don't feel people can pay attention to them before. And that's where I think sometimes you hear, don't pay attention to the cutting, don't reinforce it. But really, I try and understand from that person's perspective who's cutting, what are they needing from me right now? That's a signal that they're needing something. So if I pay attention to what they're needing, maybe they're needing me to hear that they're in pain. Maybe they're needing to be able to show other people how much they're suffering. And maybe this is their way of being able to show it. And so if I'm focused on understanding them, then I can respond to it. It's, I want to make sure that they don't need medical attention. That's really important. But it's not about focusing on the cut itself. It's about focusing on what it's telling me and what it means. So I might say, oh my gosh, you must be in so much pain right now. And it sounds like this is your only way of telling me that you need help. And can we find another way for you to tell me so that you don't have to cut? You don't have to resort to hurting yourself. I want to learn another way of being able to notice your pain so that I can help you, right? And it's not about whether it's cutting or substance use or any risky behavior. It's not about focusing on the behavior. It's about focusing on what is leading them to choose that behavior. That's really where I want you to focus as someone who loves them, is if we don't want, we want to sort of shift away from the aid that they've made to the underlying issue, which is they need something, they're in pain. Because it's cutting today, it's cannabis tomorrow, it's sex the next day, it's, or the next month. It's those things in a sense are interchangeable because they are all ways that we have something help us manage those unwanted feelings or that unwanted pain. It's really not about the cutting. It's really about the pain, the emotional pain that they're in. I hope that made sense.
Oh, it made a lot of sense to me. Yes, thank you. The other question here, which I thought was interesting, is there any practical exercise to do with kids and family in order to reduce suicidal thoughts and self-harms?
Practical exercises. Well, my answer that I just gave is good for this one too.
Okay.
So even though, look, when someone says that they want to die and they're suicidal, it is the scariest thing you'll hear. It is incredibly complicated to know how to help them to keep them from dying. And it would make anyone feel completely helpless. But it's about the pain that they're in. People express suicidal ideation because they feel they're in pain and they feel alone in that pain. So practical exercise is talk to them about their pain. Understand it. Help them feel less alone. Help them learn how to reach out when they're feeling that way. Those are things, and they don't have to reach out to you. They can reach out to a crisis line. Like, you don't have to be their therapist. But can you help them feel a little less alone in their pain? And, studies have shown, and again, that talking about suicide does not increase the risk of suicide. And it's exactly for that reason, because people who are suicidal are in pain and feel alone in that pain. And if you talk about it with them, they feel less alone. So they feel less suicidal. It actually has the opposite effect. What you have to do as a parent or a caregiver or a loved one is do your own assessment around that to say, are there things that they could use to hurt themselves that I can put away, that I can take out of the equation? Can I tell that they are thinking about tomorrow and that there's someone in their lives they're staying alive for? These are questions I would ask myself if I had a loved one who told me they wanted to die. But what I would talk to them about, is their pain. I wouldn't shy away from it, if that makes sense.
It does. It does.
Yeah, we've got a lot of questions.
There's so many here. That's
we're
it.
Almost at 8:00. Okay, while you're scrolling through,
yes, thank you.
I'm going to ask one. I've had a couple come up about consequences.
Mm-hmm.
And when you talk about natural consequences, how do you recognize what's the appropriate situation when you need to allow natural consequences, or where do you draw that line? And somebody said, like, okay, so the natural consequence at this point, my kid's failing grade 10. Somebody else said, is it a natural consequence when they reach the point that, their substances are being used to the point of poisoning themselves? Mm-hmm. So, I mean,
you want me to answer that in a minute and a half? They're all natural consequences. A natural consequence is a consequence that occurs naturally as a result of the action, the choice. So not attending school and failing the course, that's a natural consequence. Using to the point of poisoning your body is a natural consequence. You may not like it. It may be scary and it may put them at real risk. It doesn't mean it's not a natural consequence. And there are times where you will have influence over someone's choice. And if you do, you should exercise it. If you have influence, if you have control, take it. If that prevents harm, absolutely. Especially if we're talking about younger teenagers where you do have relative control over their whereabouts and their comings and goings, exercise it. If you don't, that's when natural consequences need to happen. And again, it's not about how scary it is, and it's not about how big it is. And there are life-threatening natural consequences. And I don't shy away from talking about it, because death is a real possibility, I'm sure, for a lot of your loved ones and a lot of people we know. It doesn't mean that to help them means that we step in at all costs. And not only because it doesn't help them learn, and that sort of feels silly when we're talking about life or death, but because you actually sometimes can't do anything about that. And if you can't do anything about that, then you need to focus on what you can do something about: protecting yourselves and your other loved ones, ensuring that you're okay, making sure that your property is okay, and that they're not putting other people at risk, making sure that you have the supports that you need to weather these enormously scary storms. All of those things are things that you need to do, but you won't always have control. You can try, but I will tell you, there will be far bigger consequences of trying to wrestle control constantly in someone else's life. It doesn't matter how scary it is, how awful it is, or how much you want it to change. It's their lives, and you ultimately don't have control over that.
Yeah, that's the hard reality.
Yeah. And that's where reality acceptance comes in. We can close our eyes and pretend things aren't happening and want a different reality. But as soon as we uncover our eyes, we have the reality we have. And then I have a choice. I can live in a different reality and then wonder why I'm in so much pain. And that's because my wanted reality and my actual reality are bumping up against each other. They're not the same thing. Or I can manage the reality I have and find ways of finding relief and solace and coping and all of that in the reality I have, not the reality I want. I know that's what we want, it's just not what we have.
Thank you. There's a lot of wisdom in that response, I think. I wonder, we're at 8:01. I wonder if you have time for just a couple more, because I see most people are still hanging in here on the call. So they're hanging on your every word. I'm going to ask a question that kind of ties in with a lot of things, which are, is there more commonality maybe, or more difference in the relationship between substance use and different types of mental disorders? So some of the things that have come up are around borderline personality disorder, autism spectrum disorder, ADHD. Like, is there more commonality around the fact that these are simply adolescents,
right,
at dealing with what adolescents deal with and mental health issues, or is there something specific about certain mental health areas that can interact differently?
I'm not a research expert, so I wish I had a really evidence-based answer for you. I have, I think, my own anecdotal experience or my thoughts about that. Certainly there are disorders that are more prevalent in youth than others, and there are substances that are more prevalent in youth than others. They don't necessarily always go together. I think it's probably more a factor of the type of substance and what it does in your body and what you are already experiencing. So some substances are depressants, so they calm your nervous, they suppress your nervous system. So that might be really desirable for someone who has, ADHD, or is really like ramped up and wants a substance like cannabis or alcohol or something that suppresses the nervous system, calms them down. For other, stimulants really help, right? So if you think about actually someone who has ADHD, a stimulant medication, someone who has ADHD has parts of their brain are understimulated. So if you add a stimulant medication, it sort of brings your brain back to normal levels. So someone with ADHD might use cocaine or a non-prescribed stimulant medication, and they might really like that because it actually feels good in their brain. So it sometimes sort of depends on the combination, but I've certainly seen every combination under the sun, and it depends what it helps with too, right? I think if someone is in, I certainly have worked with a lot of people who use opiates who are in a lot of emotional pain, and for the time in which they, are under the influence of the opiate, they don't feel anything at all. And that's incredibly helpful for them, So I wish I had a better answer, but I think that it really does depend on the relationship between what's happening in their brain and what they're already experiencing.
you. Kathleen, do you have a?
I have two questions. One is really quick. A couple of requests is, Adina, do you have a website?
Me personally, I don't. Unfortunately, not at this point.
Okay.
I've also got a couple questions from my side that, are asking if you do private counseling, if you are available to do support privately. I can mention again that you are part of the Transitional Youth Program, which is at Michael Garron Hospital in Toronto. That used to be called General.
Yes, in Toronto. I have a day job that is not in private practice. I, at this point, do not have a private practice, although I'm happy to advertise one when I do. So we could Google my name slowly over time. We'll see what happens.
Okay, and my screen changed. The question that I was going to ask, does it make sense eating disorders can also lead to other addictions?
Yeah, probably. Yeah. I mean, I think, an eating disorder is the same. Sometimes we can see it in the same context, right? A mechanism of control for deep emotional pain is much like another mechanism of control for deep emotional pain. So sometimes people develop an eating disorder as a way to control parts about their body or about their mind that they don't like, can't tolerate, or do not have control over. And you can see substance use in the same way. I don't know if we could say that there's a correlation between the two, but I sometimes like to think less about the particular illness or diagnosis or about the particular substance, because I don't think that's as relevant. What I think is really relevant is, again, what it means for the person, what it's doing for them, what's the function of it, right? So again, if we think about eating disorders in the function of it being something that gives someone back control, what that's really saying is they don't have that control in their lives, that they need to be okay and to grow into functional adults and to grow into people who can manage their emotions. And whether it's control through substances or control through eating, they need to learn how to find control in other ways. And then the need for restricting eating or throwing up or whatever it is, that need disappears. It goes away. They don't need it anymore. And the same is true for substance use. If you have other ways of coping with your emotions, you don't need that substance anymore. And what we notice in people is that it starts to detach, right? That association starts to detach. Your brain all of a sudden has lots of space for it prioritizes other ways of coping that are more effective or have more long-term effectiveness. And it no longer needs the substances in the same way. So we start to see the relationship changing with the substances. And again, in my practice over the years, when I've worked with people, again, it's not so much about the particular substance, because what it all comes back to is what it's doing for them inside. And if you give them the tools, if they develop the tools to fix what's happening inside, they don't need that stuff anymore.
Okay. And then the last question I have is how to make my teenager understand the consequences of using cannabis when his first response is it's legal and have so many beneficial and it's natural. It's helped in his case for anxiety.
Mm-hmm. No easy answer, because from hearing that, it sounds like what your kid is telling you is there are reasons this helps me. There are reasons why I think this is not so bad. And there's reasons why I want to keep it in my life. And it's not those reasons and consequences are not mutually exclusive. They can both exist. But for someone who has more reasons to stay with the behavior, to keep using than not keep using, even if there are consequences, they're pre-contemplative. And if you go back to this idea of what works best when someone's pre-contemplative, it's not about harping down on the consequences of that choice. They're not going to hear it. They're not going to hear you. They're not interested. They'll live with them because they're more motivated to continue the choice and the behavior, or to see the ways that it's helping them, the ways that it's not. And so you're not going to convince them of anything. What will work best is allowing them to experience natural consequences. and helping them when they see those natural consequences, helping link that to the choice that they're making or what they're doing. So it may actually reduce anxiety in the moment. We know weed sometimes does that for people. They feel less anxiety while they're high. Then some youth, when weed leaves their system, they feel more anxiety because it was just suppressing it. It wasn't actually fixing it. A lot of youth have that misconception that weed takes away your anxiety. It just takes it away in the moment. It doesn't actually solve it. But we know that CBD has some properties that do relieve some anxiety momentarily. So he may experience natural consequences. And as you notice them come up and through your relationship, if you have a solid foundation, you'll be able to have these conversations to see how he understands it and where he's at. And you may have to wait until he's a bit more contemplative about change before helping someone see the consequences works.
Thank you. I think that's all that I have.
I still have a lot of questions, but I see that we're already at 8:10. I apologize that we can't get to them all. What I will say is just a couple of things that there's been some, really challenging, difficult, risk-involved situations that have been mentioned in the questions. So I'm sure Adina would agree that we would always recommend that safety is the first priority. And if you need to seek professional and expert help, please do so. If you're in the Greater Toronto area and your youth is, I believe, under the age of 29, then the Family Navigation Project through Sunnybrook Hospital,
26, I believe.
26.
Yeah.
Then they do navigation services and they can help you find the appropriate services for your youth and also for your family members. There have been a couple questions about people wanting supports for other family members like siblings, and the Family Navigation Project can certainly help you with that if the main person struggling is a youth in your family and you're in the GTA. I just want to also mention that you can email Sashbear if you would like to, just to be able to ask about any resources that we may be able to point you to from different parts of the country, or if we can maybe talk to one of our experts and see if we can find an answer for you. We will certainly do our best. So once again, I just want to say thank you so much, Adina, for being with us tonight and sharing your wealth of information. So much of what you've talked about really sort of parallels a lot of the things that we cover in Family Connections. So I would really encourage you, if people have not taken Family Connections, please make sure that you're on the wait list for Family Connections in Canada. And again, you can do that through the Sashbear Foundation. And also just to let you know that the Sashbear Foundation as a charitable organization always welcomes donations to help us with our work. We don't get any government funding. So if you have benefited from this presentation or from Family Connections and you want us to continue making these services available to other family members, we would love your assistance and support with that. So with that, thank you everybody for joining us. We'll post the recording in a couple of weeks on our website and our YouTube channel. And thank you again, Adina.
Thank you
everyone.
for having me.